Good day everyone, welcome to Kuya Pharmacist channel. Please remember that this video is intended to provide a quick guide on the active ingredient or ingredients or product presented by a community pharmacist. And this video is not intended to cover a piece of comprehensive information on the subject being presented here. If your symptoms persist or a new symptom appears, please consult your doctor or your healthcare professional. Before I start the video presentation, I would appreciate it very much if you can subscribe, like, and share to support my channel. Without further ado, let's start the video presentation. The drug on review for today is Metformin 500 mg film-coated tablet. It exerts its effects by inhibiting gluconeogenesis. Gluconeogenesis is the process of making glucose from its breakdown products or the breakdown products of lipids or proteins. Gluconeogenesis occurs mainly in cells of the liver or kidneys. It also increases peripheral glucose utilization. It is also useful in overweight and obese patients since it does not increase weight. It does not provoke hypoglycemia or lowering blood sugar when used. Metformin is indicated in the management of type 2 diabetes mellitus. Diabetes mellitus is a disease in which the body's ability to produce or respond to the hormone insulin is impaired, resulting in abnormal metabolism of carbohydrates and elevated levels of glucose in the blood and urine. The dosage of metformin for diabetes mellitus. For the adult oral dose, initially take 500 mg with breakfast for at least 1 week. Then take 500 mg with breakfast, lunch, and evening meals, or take 850 mg every 12 hours with or after food. The usual maximum dose is 2.5 grams daily in divided doses, or follow the dosing instruction of your doctor. For children greater than 10 years of age, the oral dose is the same as the adult dose. Let me repeat it for you. Initially, take 500 mg with breakfast for at least 1 week. Then take 500 mg with breakfast, lunch, and evening meals, or take 850 mg every 12 hours with or after food. The usual maximum dose is 2.5 grams daily in divided doses, or follow the dosing instruction of your doctor. There is a dose adjustment for the following patients. For senior citizens or geriatric patients, please use it with caution, reducing the dose, or discontinue use if necessary. For a patient with kidney and liver problems, if the case is mild to moderate impairment, a dose reduction is needed. But if the kidney and liver problem has a severe impairment, it is best to refer the patient to a specialist. Take metformin with meals to reduce stomach upset. Please note the following on how to take metformin. Take it as prescribed by your doctor or healthcare professional. If you have forgotten how to take it, visit your nearest pharmacy, bring your prescription, and ask your pharmacist how to take it. Remember to take it with a full glass of water, do not double dose, and do not self-medicate because this is a prescription medicine. Do not take metformin if you have the following condition: ketoacidosis, severe infection or trauma, dehydration, alcohol misuse, moderate to severe heart failure, respiratory failure, recent MI or myocardial infarction, liver problem, and the risk of tissue hypoxia or deficiency in the amount of oxygen reaching the tissue caused by sepsis. Sepsis is a serious condition resulting from the presence of harmful microorganisms in the blood or other tissues and the body's response to their presence, potentially leading to the malfunctioning of various organs, shock, and death. The common side effects of metformin are the following: abdominal pain, anorexia or lack or loss of appetite for food as a medical condition, asthenia or abnormal physical weakness or lack of energy, diarrhea, disturbance in taste, dyspepsia or indigestion or upset stomach, headache, flatulence or passing wind or farting, metallic taste, nausea, upper respiratory tract infection, vitamin B12 malabsorption or the problem in the absorption of vitamin B12, and vomiting. These are some of the rare side effects of metformin, such as acute hepatitis and lactic acidosis. Lactic acidosis refers to lactic acid buildup in the bloodstream. Lactic acid is produced when oxygen levels become low in cells within the areas of the body where metabolism takes place. Untreated lactic acidosis can result in severe and life-threatening complications. Follow these tips on storing metformin. Store it in a cool, dry place and not in direct sunlight. Store it at temperatures not exceeding 30 degrees centigrade. And remember to keep this product away from children. Other advice that you may want to keep in mind regarding the use of metformin: do not take it if you have an allergy to it or its ingredients. Let your doctor or healthcare professional be aware if you are undergoing the following when you are on metformin medication: if you are undergoing an X-ray procedure and using iodine-containing X-ray contrast media, if you are undergoing general anesthesia, if your kidney function test is not normal, if you have not done a kidney or renal function test, when you have a severe infection, trauma, or surgery, if you have a severe kidney and liver problem, if you have moderate to severe heart failure, if you will undergo surgery, if you are pregnant or planning to get pregnant, if you are breastfeeding, in this case, your doctor may monitor your baby or infant. If you are taking beta blockers. Beta blockers are medicine for the heart and heart-related problems, chest pain, migraine, etc. These are the possible drug interaction of metformin and the other drugs, so please be extra careful when you are taking other medication or alcohol when you are using metformin. These are some of the substances and medicine that can enhance the effect of metformin. The examples are alcohol and phenylephrine. These substances, on the other hand, will increase the risk or adverse effects of metformin. The examples are alcohol, once again, beta blockers, drugs that can increase blood glucose concentration. Examples are glucocorticoids, antipsychotics, and calcineurin inhibitors. Thiazide diuretics when used in high doses, nifedipine, and thiazolidine diones. These drugs may reduce the therapeutic effect of metformin. Examples are glucocorticoids, antipsychotics, and calcineurin inhibitors, and thiazide diuretics at high doses. These drugs may reduce the therapeutic effect of metformin. It is advisable not to take metformin together with the following medication: oral contraceptives, furosemide, and hydrocortisone. My health and safety tip advice when using metformin: remember that metformin may rarely cause lactic acidosis as its side effect, but lactic acidosis has potentially severe consequences. That is the reason why you need to be aware of the general signs and symptoms of lactic acidosis. Please remember the following signs and symptoms so that you may be aware that you could be experiencing them. For instance, nausea or feeling sick, vomiting, bloating, abdominal pain, lack of appetite, feeling generally unwell, difficulty in breathing. You can call and coordinate with your doctor or healthcare professional so that they may know what is going on with you. It is necessary to have a healthy kidney when you are undergoing or when you are already on metformin treatment. So it is advisable to have your kidney function test done twice a year. And lastly, try not to take alcohol or alcoholic beverages like wine, vodka, gin, beer, or similar drinks while on this medication, because alcohol will hide or mask the warning symptoms of hypoglycemia. That's all for now on metformin use awareness. Once again, if you need more information about this drug, please visit your nearest pharmacy and talk to your pharmacist. And before I end this video, kindly check my YouTube channel, Pharmacist, for other videos. If you want to see my new video upload every week, please hit the notification bell and subscribe. See you again in my next video. Thank you.